realize we weren't updating it still every day.
Can anyone confirm that we're up live and
There's a note on there that says it
streaming?
won't be updated.
Oh, it'd be suspended during that
Dr.
time.
Lorenz?
Can anyone
Dr. T, are we
confirm that
streaming?
we're up and streaming, that we're live?
Do you see, is it on there?
It says it, yeah.
Okay.
I didn't read that it was suspended. I've been,
No.
I guess I.
It's okay, I probably should have put it in a right color.
Well, it's in red. I just didn't read it.
Hey, Keeper. Thanks. We were live?
1 minute.
Okay, thank you.
All right.
Up and ready? Okay. Thank you. I'm going to call this meeting to order. Please join us in the Pledge of Allegiance. The flag is located right back there. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Need a motion to approve the minutes of the October 20th, 2020 meeting.
So move.
Second. Any discussion?
Call question?
All those in favor? Aye. Any opposed? All right. Approval of the November bills totaling $1,184,134.98. I know that we had some board questions about that were handled beforehand. Any lingering questions or worthy clarifications?
No, ma'am. So moved.
So we got a motion on the floor. Do we have a second?
I second.
All those in favor?
Aye.
Any opposed? All right. Need to approve the monthly finance reports. Gotta get myself caught up on that agenda. Any lingering questions? If not, then do I have a motion?
Make a motion.
Okay, I've got our first motion. Do we have a second?
Second.
All right, I think that was Mr. Jakes. All those in favor?
Aye.
Any opposed? Okay. Now we move to the approval of the early graduation requests.
I have a question.
Please.
Is this an unusual number? I'm not used to the numbers. Is this about normal for early graduation requests?
Ian, do you, or Kristen, do you all remember about what the average is? Yeah.
Linda's saying it's about
It
the
looked very
same.
similar to what it was. I think it's a
Yeah,
slight.
we usually have.
Okay, good, because I've never
Does
seen the
20,
numbers
21,
before, and
I
I can just, just remember. And
Yeah.
that's my only question.
I do have a second question. We required them to have proof of application for college admission, but those weren't included. Is that normal that we do not get to see that information?
I do not know that. The question was, the college application is supposed to be included in the request, and there wasn't a note of that. Do you know if it was, if they were included? Okay.
I do know that the policy, correct me if I'm wrong, but the policy states that if they've made, if they have achieved all of the graduation requirements, then they will be allowed to graduate. Am I misunderstanding that policy?
So I always understand.
In the 7 semesters, right? I think that is the key word. Yeah. Yeah.
So regardless of whether we saw the college application, we'd still be,
Right, it
Because
just
some are
says
going
that
to
that
work.
is documentation that's supposed to be proof of, so it was missing in this documentation if they chose that selection.
from what we got.
And there was a few of them that had chose that selection and they weren't there.
Yeah, and the ones that had gone jobs had written a
Yeah.
letter or something. Move we accept.
Second. Matt did come.
Yeah, Matt second, yeah. All those in favor?
Aye.
Any opposed? Okay. Congratulations to these early graduates. Approval of the SCCC program review. Quite a little bit in here. We can pause for questions, clarifications, etc. I'm catching myself up, getting past the early grad requests. There we go.
Matt? Can we want to talk about expansion or wait? Like this programs? I know it's something you were interested in.
I cannot hear you. If that's a conversation that we're all supposed to be having, I can't hear you, Harry.
Yeah.
I think Harry was asking about whether there was some particular previous point of conversation that warranted being brought up here.
Yeah.
I think it's gone over Matt's head too, so, yeah.
Okay.
So,
Could we
yeah,
get an update from Callie? Can we get an update from Callie? Or,
I
do we
think
need
so.
to?
Is Callie here? Hi, Callie.
She's here.
Hello, greetings. I know we had talked about getting a sort of oral report from you about SCCC in general, and then I imagined that the building level administrators might not be here because of Phase 4. So there wasn't a lot of follow-up about like, here's what we'd love to hear Callie talk about. It was like, I had just emailed Dr. Mayer about it, and then like a day later, we were in Phase 4, right? So,
The questions that you did email her were, yeah, I made sure and included those in writing, so if there's something specific that you would like, I'll be glad to address that, but I didn't prepare anything for you.
Okay.
yeah.
I just wanted to make sure you didn't have anything else to share. Just, I didn't want to ignore you.
Everything's there. We are doing great. Have a good day.
And before the meeting, I specifically asked her a couple questions about the programs I was interested in, for the numbers especially.
Move that we accept the report.
Do we have a second?
Second.
Okay. All those in favor?
Aye.
Aye.
Any opposed? All right. Thank you very much. Okay. Let's move on to the approval of the Adult Community Education Program Review.
And I'll speak for them if you have questions.
I did not.
I think, was this where I had a note about what was the drive-through education thing? What was that?
So,
I
it's
missed that.
Adelia, and I'm sorry I don't have it right in
Yes.
front of me as to
Yes.
what institute was hosting it, but they had a drive-through for adult education or continuing education. Anyone that wanted to bring something, people would drive through and they could provide them with information. So both Laura Jackson and Heather Tegent went and represented St. County Career Center, talked to them about our continuing education through our community ed as well as our PED program.
Okay, so outreach to even as far away as the Sedalia community about what our programs offer. Great, okay. I'm repeating that mostly for the sake of the folks at home. Yeah, thank you. Any other questions? Do we have a motion?
Make a motion.
All right, yep, no, that was Ed,
I'll second
and now we have Harry. All right, all those in favor of approving the Adult Community Education Program Review?
it. Aye.
Aye.
Any opposed? All right, thank you. Let's move on to the Library Media Program Review. Normally, Ms. Gaskell gives a pretty robust, in-person PowerPoint spoken presentation, so we will just have to imagine that that has been the case this year as well. We have a very detailed report from her in her stead. Alas, she is hopefully safely at home, enjoying her evening. If any of you had any questions you had asked her beforehand and wanted to provide any of that clarification, feel free. Otherwise, I'd love to entertain a motion.
It was interesting to see that books still have a way of disappearing. I think I've got a couple on my shelf somewhere.
And it's worth noting, I at least appreciated having her data about the physical and digital checkouts, and it was heartening to see that the numbers were still high, even in this, even in the 2019, 2020 school year. There wasn't that much of a drop-off. I know we,
I was surprised there wasn't much of a drop-off.
yeah.
Yeah.
Yep.
Really is.
I make a motion that we accept the report as given.
Any second?
Second.
All those in favor?
Aye.
Any opposed? All right, and now we must move to adopt the regular agenda.
As written.
As printed there in front of you.
We got a new one before the meeting started, Brian. did you get
Correct,
to know?
yeah. Oh, please silence all devices.
So moved, if there are no additions.
Please silence all devices. I feel like I'm at the movies.
Can you move it? Can you move it? Look,
I
yeah.
got one motion.
I'll second.
There we go, second. All those in favor?
Aye.
Any opposed? Okey-dokey.
Okay.
And now we move on to public comments. We welcome Dr. William Kavanagh. And Dr. Kavanagh, I have 5 minutes on the clock for you. Do we have a microphone
There's one
for
over
a
here. on
speaker?
the-
There's one there?
Yes, there is.
Okay. All right.
You're on going, sir.
And let me know when you'd like to start.
Pardon me?
Let me know when you're ready to start.
Oh, well, basically what I want to do is just let y'all ask questions
Oh, okay.
about this, because it's pretty much straightforward, so just ask you your questions, and then once the questions are finished, you want to vote on it, or take it, put it, figure out what we're doing, what you want to do with it.
Well,
Then you can just let me know.
let me hit pause long enough to issue a clarification. We don't customarily comment on public comments at the time that they are given. So that said, I'll happily sit here and I'm going to put the clock back on once I get done. And if anybody's got a question, they can.
I got one after he's done. So, do we ask now?
I guess
Question
it's our
for you on the
time.
cost of that. What fund would that come out of if we adopted that later on? Is that part of the CARES Act or?
That's what I was thinking. I talked with, over at the county commission last week. I had talked to them recently that they had $400,000 left in the CARES Act. I kind of talked with them about what I planned to, talk with y'all about. So I don't know if it's dedicated for anything, but I think that would be where I would go and try to get the money for this.
So what's the frequency of the tests? I mean, kids come through the door, they do the saliva. Do we know on the spot or how?
You can't hear it unless you got headphones.
I'm gonna step forward, maybe that'll help.
So
Yeah.
if they come through the door, we do a saliva test. Is it on the spot? You can tell if they're asymptomatic or are they positive or negative? Can we tell that on the spot?
No.
So-
What we'll have to do is basically, all of it's going to be put into one big batch for batches for different schools. I'd like to, for us to do school rooms. That way, if we have a batch, we can go to that school room and say, okay, we're going to test everybody in here because we have a positive case that we've seen. The fecal testing that they're doing now is very, very sensitive. It's like 1 to 10 viruses in the sample. You can see that little. And so I'm thinking if we do this, we can figure what we've got in the school.
So is this gonna be a weekly test then? I mean,
It'll be daily.
a daily test?
My concern, and I expressed this to you strongly before, is our teachers have got enough things going on now. If our teachers are going to be asked to be doing this, I think,
No, that wasn't my intent.
Okay.
I'm not up to date with what you guys have been up to. I'm wondering if we've gone to the nursing schools and looked at maybe getting some of the nursing students involved in this kind of thing. I mean, this is going to be what they're going to be, asked to do when they get out of school. So we could get some of the nursing students to come in and take care of this. Probably if we had, if we can get some of this CARES Act money, we might just pay their tuition for the semester or something like that and get some, get a few of them there. There's a lot of things that I've thought about, but I don't really want to get into all the little particulars here. What I want you to realize is if we can identify the patients early on, just like the universities are doing, we can do it with saliva tests. And just batching them, then we can come back and we will be able to find them in advance, possibly before they're even symptomatic. If you get them before they're symptomatic, they're less likely to transmit.
Well, I mean,
So-
I think go ahead, Brian, go ahead.
So in looking at this situation, you're saying we're, like, if we do it classroom by classroom, and we take a second grade classroom and we find out there's a positive in this second grade batch that you receive.
Right.
So we basically know nothing about the true person that it goes back to. So then we have to go all the way back and then test by individual within that classroom?
Then you do the
Or we'd
COVID
have to
test, an actual
quarantine with
COVID
everyone
test.
in that classroom. Is there any data about how this actually works over time, or actually if it decreases, or is this just kind of a newer thought to kind of isolate? I know that a
1
lot of
minute.
universities are doing this. I know
1
MU is
minute.
actually specifically doing this on campus with fecal material. But I don't know, how long would it take us to narrow this down? Have we missed the window by the time we found somebody possibly?
See, that's what we've got to find, that's another thing on my agenda, is to get us where we have a machine here in the county that we can do the testing on a daily basis. I think that's the true thing is to try to get that.
30 seconds.
Okay. Thank you, sir. Ellen?
I don't have anything.
But I can help y'all.
Yeah.
You know, if I'm here, I've got behind this, trying to. So if you want me to head this up, I'll be willing to get started on it. Just need to let me know.
Thank you, Dr. Goodness.
Perfectly timed. Yep. Okay. All right, let's see here. Moving on to reports. First up, the Assistant Superintendent report. Dr. Lorenz, we did receive your report with the board packet, so if
Yeah, I'm
there
just
are
going to
any
highlight a couple of things.
highlights,
Be
yeah.
very short. It was a fairly short month to begin with, but I did want to mention that the contract language for the fiber project has been settled and signed. We're in the process of getting ready to start staging the fiber out in the south parking lot at the high school, fiber and equipment. So hopefully, we'll see how soon we'll be able to get started up on that. I think I mentioned before, we're trying to set up a school zone out here with the city on Slater and Lincoln. And the necessary paperwork for the Evans Lawn Care has been delivered and it's in order. Just a couple of quick notes out here. I know I heard a couple of people ask about the Clever Touch. That's what you see over there, a couple there in that box, a couple over here. Those are basically smart boards that are going in first grade rooms. We were able to get some of that through CARES money. We haven't had a chance to start setting up too many of them yet with, when we went back to, they were just starting into them and we went back to distance and they got kind of swamped with all the requests from home users. So I think we're hoping after we get back from Thanksgiving, we'll get back to getting those installed. Out here on this project, just a couple of things left. We have one more payment to make and we won't be making it until we get all these things satisfied. But I'm having them redo the bathroom floors, all the ones in the safe rooms and the big one. They just weren't satisfactory. So that's going to be done yet. There's trim that needs to still be put on the roof of the kitchen addition. A couple of odds and ends, but we're like I said, we're not going to be paying until we get all that work done satisfactorily.
Dr. Lorenz?
yes.
Hate to bother you on that. What about the cabinetry in all those rooms? Have those drawer pulls and those things been kind of ironed out? where
Yeah, they got it
wasn't working?
fixed. They had to come in and tweak. There was a shim they had to put in every,
In everyone?
what they
Okay.
told me, that's what they had to do to fix it. It was
Okay.
just slightly off and it was causing the pressure on the,
I just know as much
Yeah.
cabinetry we had in there.
Yeah,
It just wasn't
no.
functioning smoothly, so.
no, I haven't, and since it's happened, we haven't had another, that I'm aware of, another hinge come free, so.
Thank you.
The only other things you can read, but the distribution's been, we had a Cindy Brandt from Tyson Food donated 3 6x10 American flags to the district, and Troy attended a retirement ceremony for several flags that we had that were older, and the 81 air purifiers have arrived, and I'm working with Matt Riley about where we're moved from here about install.
Can we make a note on there that about, this might seem small, but when we toured, there was a flag on the floor in one of the buildings. Can we just make note for them on where to properly store the flag when they take it down at night? I know it's minute, but there was one on the floor and there was one laying over a trash can in one of the buildings when we visited.
Okay. All right, I'll talk to the
Not a big
appropriate
deal, just
people.
since you're bringing it up, we might as well.
Yeah.
make that just a blanket statement.
So we have a master plan for the installation of the air purifiers? That was the
Working
only
with,
question I had in your report,
working with Matt Riley and to see,
where they're gonna go.
yeah, to see where and how. He's probably gonna have to be getting with Matt Smith if there's any questions about any of the installation, so. I mean, I understand it's supposed to be fairly easy installation, but I'm not exactly sure where Matt is on, they just came in a little bit ago, so it's on my agenda. It's on my to-do.
That was the only question I think I had.
And that's really about the size of it.
Okay. Any other questions for Dr. Lorenz? Thank you very much, yeah, okay.
Oh, yeah, sorry.
We'll move on to the superintendent's report.
Thank you. I have problems with technology whenever
You're not alone. If it weren't for students, I would not have technology in my classroom.
Stoke the fire.
I'd reach out and say, if you can run this, get up here. Otherwise, I talk all hour.
Extra credit.
I did want to talk for just a minute this evening about a couple things, both related to the coronavirus, of course. We have been discussing, and it is quite a concern for all educators, the what is called the COVID slide. And the COVID slide is a very real and very serious issue across the nation. We are used to talking about the regression in the summer of learning and of kids, their achievement in the summer slide, but this is the COVID slide. And the COVID slide is, as we say, as Sarah Sparks says here in the November 2020 of Education Week, the parents are going to be seeing, and we have seen, that the COVID slide is very real. Report cards have come out recently, and unfortunately, we have seen a big drop in achievement in core classes, and the other classes actually also. So I wanted just to look at some national data and talk to you about that. We have seen some of our data and how our students have been affected. We are not alone, and unfortunately, we are not, I guess I should say we're not vaccinated against the negative impact. But in the Dallas Independent School District, 30% of students have lost learning and reading and 50% in math. For some reason, mathematics seems to be more impacted than the other core subjects, but they are all impacted. And as the quote down here says, that if you look at how students are doing this fall compared to how they were doing in the late winter, when this all hit, the learning loss is significant.
Dr. Mayer,
Yes.
bring that microphone a little closer to you.
Oh, okay.
Especially since the
Thank
bridge
you.
just kicked in.
I had just spoken about the learning loss across the nation from the COVID slide, and I am going to send out this report so that if you do need it, or if you want to need me to repeat anything, just let me know. A reading forecast from the Northwest Education Academy research, which has involved the University of Texas and Duke and several other Research One institutions. As you can see, the COVID slide is marked with the small dots. And the younger the student, the more impactful the slide is. As you see, the school closure happened significantly before the typical last day. we do have summer slide each year, but the COVID slide is much more impactful, and the younger the child, the more impactful it is. You can see here the the mathematics forecast, as we had said before, is even more significant. Going down to third grade, you could see the summer expected loss and then the COVID expected loss. There is quite a bit more of the loss in the third grade in math. This is a really easy slide to read and to figure out. We have our typical student achievement, and of course, we have our summer slide that starts when school is out in the late spring. But the COVID slide happened in March for us, and the effects of that on student achievement were detrimental, and in some cases were almost devastating.
Dr. Mayor,
Yes.
I didn't know if you want questions while I'm done your.
No,
your
go ahead, that's
presentation.
fine.
How are they measuring this slide? What, is it just more than just grades, or how are they measuring
I think they
the
have.
COVID slide? I know how they
and-
measure the
And
summer
I'm
loss.
not certain, and I wish Jim Paprick was here to talk about forecasting, but what I gather is that the statistics that had a significant correlation then, and I think that they were measured on a cause and effect relationship. The slide then was projected from that, taking the months that were able to be measured from summer. And then, I don't know, Harry, it's a good question as to how they were able to then say, well, this is going to be 3 times worse than a summer slide. So the statistics were projected and I don't know if they used a regression model or how they did that, but I will be glad to look that up because I'm kind of a statistics geek as it is. They did look at the 2 areas that they did review, though, were the impact on pre-existing achievement gaps, and those were the gaps that we know about. The gaps in our students who are on free and reduced lunch and our students who are not. The racial achievement gaps, the language achievement gaps, we know about those. We also then have come to know about the typical grade level skills and the knowledge-based skills that we think students should have at a certain age. And those were the 2 areas that they reviewed. So that was, this slide here was projected from those institutes. There has been a lot of conversation about the new governor's recommendations and guidelines. The Commissioner of Education stood with him while he made those recommendations. On Thursday, guidelines, a Q&A were published by DESE, and so I thought we would just go over the basic items that are significant, I think, to us. So one of the questions was, will the students who now, and for those of you who didn't see the governor's guidelines, he is suggesting that if students and adults, students among adults, students and adults, or adults among adults, if they are in a school that has a mask mandate, and one of those becomes a close contact or is identified as a close contact, then they do not have to quarantine if there is a mask mandate. The question is, will this be, can our students take this home? Can our students feel comfortable outside the walls of school? And the answer to that is no. This is only in school, and it is only for students who are exposed in the school setting. So that is quite, that is really quite, what am I trying to say? It's really quite challenging for schools to figure out how in the world to tell where these contacts were made. So if the contacts were made and the child is not in school, then of course, we can't say what the family will decide or what the parents will decide. But the recommendations are still saying that close contacts should still quarantine, except when at school. Persons identified as close contacts are not allowed to participate in sports or activities according to this document. According to how the governor or how DESE now is explaining this, that this does not pertain to school-associated sports, extracurricular activities, or other sports outside of the school setting. So other than attending school and just attending school classes, close contacts should continue to quarantine. Again, does the guidance apply to any other setting besides schools such as businesses? No, the guidance is only for K-12 schools and in the setting where schools have been designated as where the contact took place. I think that's going to be very, very difficult to do. And I believe that Brian is going to report on our Returning to Learning Committee. They've done some really good work, so that is my report for the evening, and I will be happy to discuss or talk to you about any of them.
Any questions? All right, thank you very much. And we'll move on to additional program reports. Do we have any follow-ups, questions? I think I've got a couple, but I'm going to yield the floor first. Anybody else who has follow-ups, questions?
I have a couple that I emailed out for response, but not necessarily for now.
Okay. Let me get myself caught up then.
Special ed curriculum data analysis of the system.
Yeah. Reports, item C. I don't know what a rocket book is. Ms. Gillespie, what is a rocket book?
It is a book. Tim actually has her.
Oh, okay.
Basically, you can write on any page in there, and then there's a little QR code at the bottom that you can scan and goes directly into your email or into your Google Drive. And so we had principals doing their observations and evaluations by either taking their computer in or they would go in and handwrite it and then come back and type it. And it was just losing a lot of time and the immediate feedback that we so much look for. So now they're able to handwrite that and immediately scan it to the teacher. And maybe by the time the principal out of the classroom is already in the
Wow, that's awesome.
That's cool.
That's awesome.
And I've had teachers tell me it's awesome because they get it so quick, and majority of the principals said something about how much they're enjoying.
Read the report,
The
Matt.
only required documents will have to be typed now if there's some that's going to be in the school year.
Okay.
Huge help, I guess. Yeah,
Sorry?
huge help.
Yes.
Wait,
I'm
good.
hoping it's saying.
Good, I see all your heads, I see
Yeah.
a bunch of bobbleheads out there. Yeah, good, that's awesome.
And we can, so the really nice thing is it can scan through our copy machine, so if they wanted to put something else that they collect, like our one sheet required observation for the teachers that is in there, and a couple of other feedback forms we use, but if they have one they specifically use for their building or their teachers that they've created that still meet the feedback and observation requirements, they can run it through the copy or put it in themselves. But the required documents for the district are in there.
That's great.
It does lead me to another point that I had. This is under your section for teacher evaluations, feedback, and growth plans. This is the second bullet point about collecting, and so instead of collecting the evaluations done by each administrator, you've asked for highlights. This way, I think you mean us, the board.
Sorry.
That's okay, I'm just clarifying that. This way you're able to read the great things they're seeing in the classrooms and their buildings. And I just want to encourage, I think honesty is more important than having too positive a spin, right? If there are areas that we need to support curriculum and instruction more, we will not know those things unless you guys are honest with us about them, right? I by no means mean that we want to go looking for the bad things, but I do mean that there's something to be said for honesty. So yes, highlighting great things, but empower us to be useful to you guys by providing us with a complete picture too.
So in previous years, I would list, say, the principals have turned in the numbers of classroom observation if they had done 30-second feedback, so it was just the numbers to you guys. And I was trying to take a few things off the principal's plate with everything that's currently on there by not having to do another report to me. And so I had asked them then to highlight some of the things they were seeing in observation, and if it's something that we need help with, I mean, I've been in contact with the majority of the principals in the building about teachers' needs that we need to help them. And I, so it needs taken care of, and if there's something I see specifically from you or the principals do from you all in regards to curriculum and instruction or teacher support, I will be sure to let you know that. But I thought it's just numbers to you, and it was just another report for them, so that's why I have them highlighting in their board reports.
So I don't think any of us up here are afraid of bad news, but we are afraid of being, uninformed.
I'm sorry, your refrigerator was on?
I think that none of us up here are afraid of bad news, but we are afraid of being uninformed. Yeah. So Brian's gonna find the plug and take care of that.
Don't forget.
Food, yeah, the food department says 4 hours. We've got 4 hours, T-minus 4 hours from right now. Okay.
Wasn't that supposed to be moved soon?
Mr. Jakes, did you have some comments and questions?
I just had a question. Since we're doing so much distant teaching, are we doing distance assessments as well as in-class assessments? And I see all the nodding going on. I just wanted to make sure that was, because that's vital for us this year on finding out how that's working. So thanks for all the nods.
I will let you know that even though we are distance learning, if there's students that need to come in and do any form of assessment, I've been in buildings for the last however long since we've been in phase 4, and I see students in and out of the building, not big groups of them, it's just one-on-one, the teacher keeping them at the door, taking them to the classroom and doing whatever. And then I've heard a lot of teachers having a conversation about how they're proctoring tests over Google Meet so that we are still able to do those.
I was more talking about teacher evaluation
Oh, I'm so sorry.
versus student evaluation,
I
but.
went straight, yes,
But,
yes.
but I'm all right with that. And I saw the nodding earlier. I figured they were on the same page that I was at
I
the
was
time.
not
So.
on your page, I'm sorry, I was still worried about the refrigerator being done.
We'll get it back on.
We'll let you come back and check it.
Okay.
10:32. No problem.
I got a better idea from this report of some of the things that were happening. I appreciated the detail, I really did.
I've got some questions about what's PDC. There was the list of topics like, I think these are things that were covered by our teachers, for our teachers. This is like how to use CAMI in the ELA distance classroom, things like that. There seemed to be a lot about, how many of these are useful for secondary instructors?
So, what we had done is the district is required to provide 15 hours of professional development for all teachers every year. And so what we had learned kind of over the few years, and then also the fact that the PDP had been offering was obviously in Google, and so we were kind of missing that, what we all know we can get from professional development. This being some conversation with the professional development committee and instructional coaches, we decided to host what we were calling OWL Talks, so they were kind of like TED Talks. We have, the ones that you were looking at there are ones that were hosted at City Howard Primary and Beaker Middle
Okay,
School.
okay.
We moved to phase 4 when it was getting ready to be, the next week was upper elementary and high school, so we have postponed them.
I remember that.
And so those, and CAMI actually is a middle high school topic that a lot of
That's what I was
teachers are-
wondering
and so you're looking at it, the teachers were going in, getting a snippet of 3 to 5 minutes, just like a TED Talk, and then there were 3 to 5 minutes of the conversation. And, it was kind of in their toolbox, if it was something they thought, oh, you know what, I learned about that at OWL Talks, I'm gonna go talk to Mrs. Coslett, because she gave that OWL Talk, and get a little more information, or I tried it and it didn't work, what do I do? So it was just kind of giving those little snippets of PDC, I'm sorry, professional development for teachers, and I attended both Steinhauer and Beaker, and it was a very well-received way to provide that professional development. But again, we have postponed that to second semester so that we are not, kind of breaking the rules of phase 4 and groups of people interviewing.
Got it. Okay.
So, and I think Gina just put some of the topics, I mean, we have topics, there's at least.
sessions.
Yeah, Beaker had 11 sessions, upper elementary has 12 plans, high school I think is 9 or 12. So it's a lot of different sessions that they get to choose.
Yeah, there were quite a few here. It was just that it seemed, now I understand why it seemed lopsided to me.
Yeah.
Because it was,
I'm
and that's
sure
okay.
Once we complete the next round, I'm
Yeah,
sure
sure.
we'll see some other topics.
Okay.
But Canny is mainly being used by high school and middle school teachers right now.
Well,
Platform to help in their classrooms, so.
yeah, and it wasn't as if all of these were just irrelevant to secondary. It just seemed like,
And there is one that everybody has to not report, I'm sorry, attend, and that's one being run by our counselors, about just.
Self-care.
And social emotional needs, so, and that's fit for each grade level too, because it's by their counselors. So I'm sure there'll be more to come on Alpha. What we have, the feedback we already have, this was a very positive day.
okay, cool.
Good report.
Any others? Okay, well then, thank you very much. And we will move on to old business. I think, Mr. Jakes, I'm going to turn it over to you for the Returning to Learning Working Group report.
The Return to Learning Committee has met on the 10th of November, and then we met again for a special meeting on the 19th of November after the governor's guidance came out. I'm going to start kind of overviewing our November 10th meeting. At that meeting, of course, we talked about the Return to Learning Plan. We talked, some of these things are so dated now because so much has gone on in the last 2.5 weeks since we were there. Of course, we talked about going to the red level at that time due to community positives and our rate. That information was sent to the board the following week, or compiled at the end of that week, sent to them, and then that was turned around, and of course, we are in the red and out. We talked about the Take Flight program, how that would look, and that was to be carried out through the building level personnel. Still talked about the teachers working 20 hours on site and 20 hours off site as directed by their administrators, and pairs helping out across the district as they were directed. At that time, we had some updates from the health department. At that time, there were 130 new cases and 1 death that had resulted in the last week. They were working on contact tracing and notifications because our health department was also closed around that time. We were reported that Fitzgibbon Hospital was stretched to capacity for isolation and COVID care. They had 8 patients at Fitzgibbon at that time. There was also volume in Kansas City and Columbia, and there weren't places to actually send people to a hospital that maybe had some higher acuity needs for people at the time. So Fitzgibbon had limited visitors, and that still is continuing on. We talked about seating charts. This is an idea that was brought by an individual outside the group to the group. We talked about how those actually could possibly work and if that would help with contact tracing. In the lower grades, that was basically being done, we found out through discussion of the group. Most everybody was in similar seats, and that they only moved once or twice a week, usually on more of a Monday and a Thursday kind of move. That, of course, was just a generic answer. That, of course, isn't in practice in every single room. We understand that. We also talked about the times that children aren't wearing masks, such as lunch periods, special classes, recesses. That lunches were usually in room, but once a week they were not always in the room. They went to the cafeteria. So there are quite a few barriers with seating charts and quarantining that we felt we probably would not be able to overcome in the group, discussing it to lessen the amount of quarantines that we had. We also looked at quarantinings and positives. The health department said that the data, one of the things that we had looked at around, October 14th was we had 641 quarantines and 3 positives. But the health department said that that didn't necessarily mean that there weren't more positives, because people rarely ever check children. They go on the 14-day quarantine period, they keep their kids at home for 14 days, and they return them to school. They actually truly don't test. So it may be a little misleading in the fact that it seems like we have less positive resulting from the quarantine, but that's the case. Can you hear me, Ms. Brown? See, I'll talk a little louder. So, we did talk briefly about essential employees and essential workers, and we moved past that and did not move or did not make any recommendations from either side at that time. We met again on the 19th. This was strictly to talk about the recommendations that came out from the governor at that point in time. We talked about the fact that our nurses had completed contact tracing in many of the buildings and many of the levels here. So they were able to contact trace, and the health department was fine with that and seemed helpful or happy about the fact that we'd be able to help a little bit more with contact tracing within the district to give them better recommendations. The group was very much in support of still following the CDC recommendations versus the governor's guidance. They felt that we had a lot of unmasked times. We've got a lot of times children are wearing face shields versus truly masked, especially in the lower grades. Proper mask wearing was also an issue. Other times that people aren't wearing masks were the same with the lunches, the special classes, orchestras, PEs, music, and of course, just various times throughout the day. They felt like that their recommendation as a group would be that we would still follow the CDC recommendations versus looking at the governor's guidance. Since that time, I've also I spoke with 2 doctors at Children's Mercy today. They had the same advisement that they felt that we should still follow the CDC guidance. We're also checking with some other doctors within our community as well. One of the things that we talked about a lot is we have community spread. Most of the information we talked about is the fact that this is not going on within our buildings. We're not the transmission sites. People are bringing that into our buildings and then they're going back out with it. So we're kind of just finding cases here. We're finding symptoms. We're not the exposure or the contamination points that are going out within the districts. So kudos to everyone that's been making that work. I know that is a big task. So the other things, like I said, pre-K through 4, a lot of the face shields, and that there's very little mask wearing. So there was a lot of concern that that wouldn't even be a valid thing to be able to use in the 4th grade and under. 5th through 8th, there was a lot with PE classes, practices, orchestra, band, and a lot of time before and after school where children were mingling, or a lot of students are actually mingling with each other that aren't following all of the guidance. They're not always following the masking or those things. 9 through 12 was the same with masking except at lunch periods, and the same at State Fair was masking pretty much throughout the building because lunch didn't occur over there from what it looked like as well. So. Contact tracing with siblings is also being done. That was something that we talked about. Well, that maybe you have a child at 2nd grade, a child in 6th grade. Maybe your 6th grade child hit a quarantine where your 2nd grade child necessarily didn't hit a quarantine to identify by us calling back home and making a notification to you. But by doing your due diligence as parents, we need you to understand that if we're quarantining one set of your children, then you probably need to look at your other set of children and look at those exposures. Children that are also in the home, they're not masking at home, and those things need to be communicated back into the district if they're missed. So, sports, we talked about sports in other districts and some information with that. Ellen and I talked a little bit about them before the meeting on that, and she's got some other information at the time. Of course, we are not practicing on any level here at this time. And at the time, the administration felt like there should not be any other practicing or anything going on. I asked Travis to check back with Kristen and the groups, of course, between Paula and his building and with Ian and his team at the high school, and to see if the recommendations still remain the same following the meeting that we had last week. And that was the 2 return to learning committee minutes. Ellen, did you want to talk about the information that you'd received from talking to some other colleagues in other districts?
Yeah, prior to doing that, I mean, I guess this is gonna probably put the high school admins on alert or whatever, but where do you guys stand today? Are you guys still of the opinion that when we stopped a week ago, almost 2 weeks ago, well, it will be 2 weeks, that when we stopped, it wasn't safe and now it still isn't safe and gonna be safe? Or where do you guys, what are your people saying to you? Where are you guys at on this?
I speak for the high school, Ian Bird. My statement has not changed since the very beginning. It is not safe to go to school, for us to educate children in a classroom, and it's not safe for us to educate children on a basketball floor or in a wrestling room. I understand that that's a very difficult thing for a lot of people, but I think with the information that Brian shared from that committee and following recommendation of health personnel, they're saying that it's a community spread problem, and I wouldn't want to be contributing to that. We do our part and do what we can. As soon as it's safe for us to come to school, the health professionals tell us that we would be really excited to start together activities or in-person activities.
All right.
So I contacted, while Brian was reaching out medically, I contacted a board member or 2 in each of our conference schools to see what they were doing. I'd actually seen some photos of some activities at one of the schools in our conference, and so I reached out. There's an opinion that some have stayed and let their athletics continue because of state participation, which that's what they chose, and that's fine. Kirksville took a 2-week break. They'll be back to practice Monday. And all the rest are distance learning, except Hannibal's in school. Hannibal took the advice of the governor and went back to school almost immediately. But all the rest are at distance and still letting their high school kids participate in extracurricular activities. No spectators, but they're doing it safely. So I just wanted to know what everybody else was doing because sometimes that does matter. So.
Something else that I didn't ask to be put on the agenda for, but last week, as I've been participating in the, as a Region 5 rep from here on the state board, we had a state leadership committee meeting last week with MSBA in all 15 regions. I participated in that 3.5-hour call. On that time, we talked a lot about the MSIP 6 that's going to be coming out. We're, of course, moving from 5 to 6. That's going to be taking effect in late 2021, early 2022, they said, at that time. It's going to be dealing a lot with school board governance and of actually how the board is interacting with the district. The board is overseeing everything that goes in the district. PD is one of the big things that they were talking about, and if the board's actually involved with PD. But then when we talked about it and asked how we showed the board was involved, they talked about voting and making sure that the budget line items were still there. So it doesn't mean that we're going to be physically necessarily involved. It means that we're still going to be asking questions, making sure it's going on, and doing oversight. And that's what the site of the MSIP 6 is wanting us to look at. The governance award, which is something that I'm not aware has ever been bestowed in Marshall before, has to do with the board members themselves and challenging us to get some higher degrees and rankings. They challenged us to come back and challenge the other 6 people on our board to see about people getting advanced degrees and working towards those. Those things are given. The governance award is assigned to us by MSBA. It's not something you apply for. It's something you meet criteria for. So that goes by getting your advanced board training, by attending legislative days. It's lots of categories of which the board actually meets that, and then there is a governance award. We also talked about showing that people have attained higher degrees, possibly with something such as additions to our nameplates or things like that, so that you would know we're taking additional training beyond the basic board training that we're all required to take. The timelines are still going to remain the same for board training. It's still going to be within your first year. There's still going to be the extra training that needs to occur annually and with the same timelines. So there's a lot about the CSIP going in there, which is something that we're trying to set some dates to sit down and work on, and something that we're going to have to definitely get to and make sure that we're moving in line to the CSIP. They want to see where your actually board meetings and things are in line with the things that are on your CSIP
The
and be
CSIP
able
went
to tie
away.
them back.
Right.
The CSIP
What?
went away. It's no
Because
longer in
The
effect.
CSIP is not going away according to them.
We do
talking
not
about
have a
them.
CSIP.
Our
I-
strategic plan is our
It's going to
CSIP.
take over that. So
Right,
it'll be different
but they're still
language?
using that same
Well, the
language.
strategic plan is the CSIP.
Right.
Right.
So it's a CSIP or it's a
That's right.
strategic plan?
5 times.
It's the same.
It depends basically pretty much
Who
who
you
you
talk to?
ask.
It's on- yeah,
And they're still using it. The CSIP is a little bit of antiquated language, and they have talked about using it both ways. The people that we're talking to and leading these calls are people that have been with MSBA for over a decade. That's probably the way that they refer to it.
Okay.
Whatever it comes down to, that's the same kind of language that we're going to be using and looking at, making sure that our board goals are aligned with our community and with where our district's going and leading that way, so. There was overall discussion. We asked a lot of questions of each other while we were on the call. Made some contacts that have reached out and talked to us about some of the things we have going here. One of the things is the Nest Bus. They think that is a fantastic thing that we have going on here, and they want to duplicate that in some other areas. Monica also, when we were talking on the Return to Learning Committee call, spoke about the Nest Bus as well, and the people had reached out from MSTA to ask what that model looked like as well on that side. So not only are boards seeing that, but also teachers are recognizing that as a model or something that they can use in other areas. Grades are down across the state, as we just saw from Dr. Mayor's report.
Across
It is
the
not-
country.
Yeah, well, everyone we talk to is the state, but they're definitely down everywhere. Most districts felt that, that they kind of got a practice run at things in the fall, in the spring as they close down, and in the fall, they're still practicing and doing things kind of like we are, finding out what works and what doesn't work and how to kind of navigate through those things. Everyone's having issues with attendance and your distance learners, getting them to check in, finding out if they're actually still doing homework, sending people to the house, the same things that we're doing here within this area as well. And the parents are struggling everywhere as well. They don't understand all the platforms that are being used. They definitely don't understand all the content that is being offered, especially, they said once you get to probably middle school, that most of the parental help is falling off because they don't actually know how to do some of the things that are getting taught in those grades. So all of those things were not unique to our district, but they are problems that we're facing statewide and across the board, and everyone else has recognized those issues too. There weren't a lot of answers, but there was a lot of discussion and how we could maybe look at some other things. I've got some information, hopefully it's going to come back from a couple other people that seem to have some things going well. There's some people that admitted that they're doing it very poorly, so.
I do want to take you back to the Return to Learn program meeting. I do want to say that I did visit 2 of our lower grade classes. And I want to say that only probably 10% was wearing the mask improperly or the shield. So out of a class of 25 or 26, you're talking about 3 kids that may be doing that. So our teachers are doing a great job on making sure that they're doing what they need to do and those kids are safe. So I just want to say that good job and that is recognized. There are a few kids that it's hard for them to wear that and it's hard for all of us, but they did do a good job and I noticed that and I was in the classroom to see it.
That's great.
Okay.
Along those lines, actually, I'm wondering if the working group couldn't count, I know Ellen brought this to my attention before. We need to be prepared for when we do come back, and especially for when we come back after the holiday break. I wonder what kinds of PPE we need to have in stock for our staff, for the students, and if the working group has any recommendations about maybe how much we need to have on hand, or if that's a recommendation that just comes from building level admin or what. But I could imagine that the working group might have some special insights, maybe even in terms of where we can get stockpiles of such materials should we run out. I mean,
That has not been discussed. I'll just say that, but that's something that, of course, working with Dr. Lorenz, he orders our, their storeroom, we can find out what we need within the area. And as long as we can still order it, it's not back ordered, it's not out of stock, it's not out of whatever, those kind of things as well, so. I did talk, one of the things that came up, Dr. Mayer and I were both emailed the same question kind of about the Nest bus, about some safety concerns on the bus, those kind of things. I've already reached out to Lindsay, talked to her a little bit about what it actually looks like on the program side over there, and some things that they were supposed to be contacting, as well as the bus driver had some concerns about being on the bus, some of the teachers about getting maybe N95 masks down on the bus, some of those recommendations, and just kind of talking with you all to see what we could do that was a little bit different. Like I said, I spoke with Lindsay about this on Sunday, and so I'm assuming there's probably going to be some minor changes or differences that will probably be going on to try to work on safety there, because we are looking at that outreach. So I have also reached out to see if there are any available buildings. At one time, within some of the circles, we were able to get an apartment or a home that was able to be used for the district, or they've used it for a substation, or they've used it for different things, to see if these are places that maybe we could use that would be larger than a bus, where we could have people that actually went in, we could have desks or things set up, maybe we carried equipment in, we parked close enough to have the hot spot. Some of those things as well were some things that I was looking into maybe to help with that situation as well, so.
Yeah, part of my
And
thought
we're-
was if we've got, if they say, I wonder what their opinion would be of, okay, well, if we have enough N95 masks for everyone, what kind of difference might that make? Would that have any effect whatsoever on any of our policies and such? I don't know that it would. It's just a question that I have.
I have a question for Dr. Mayer.
Mm-hmm.
Is there any way that we can get, maybe, 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 Now, the vaccine that you guys were talking about earlier, is there a plan for the schools to be vaccinated? Or the health department come in and vaccinate our kids?
For children,
Right.
right now there are not because of the legal ramifications.
Well, if they had
But,
permission slips.
but
I mean,
I would imagine that later on, when it gets closer to the reality, I would imagine the school would be the place that people would think
Has there been any
about.
discussion with the health department about that and how it will look like?
Not yet.
There's been discussion with DHSS at a state level
Yeah.
about where those vaccines are gonna go first. So they're
Right.
working on that at a state level, but I don't know that they've,
We did ask that, I think, on the call at one point in time, but it's kind of very unclear to our health department how that's actually going to roll out. It's so new, from what I understood, so they didn't know how they would get them, how many they would get. You know, I know there's kind of a hierarchy that they've talked to on the state level of who they would start with first. A lot with medical workers, those kind of things, and then it watered down. So I think that those are being worked out on a grander scale right now, but I'll be happy to push those questions and ask to see if they can find out some information when we next meet. We're gonna be meeting probably the second week of December. We always I try to offset it to the meeting, so we talk about things, we can give some recommendations, and then other things come up and we go back and do the same again, so.
From what I would think would happen is like other vaccinations. I would think that children would be required to have them, measles, mumps, but that the school doesn't administer them. I think we'd get in a lot of legal hot water there.
it doesn't
But-
sound like that your kiddos will be in school by the time it comes out anyway, at this point. I mean,
I
hopefully
don't
it
know.
comes this summer, and then, they can get them over the summer.
I would like to see the schools, as we are required for children to be vaccinated against measles, mumps, et cetera. I'd like to see the same for COVID, that they can't attend school until they're vaccinated. That opens a whole lot of doors that we're not ready for in this discussion, but I foresee that happening.
And speaking of open doors, are we still looking for, I know we've got the esteemed Dr. Haug working on the working group as a representative from Fitzgibbon, and peace be upon him. He's a hardworking guy. Did we reach out to Katy Trail or any of the other area health providers to see if we could get
I did
input?
not reach out to Katy Trail. I have reached out to a few other family practice providers within the area to see about getting some other feedback or directly onto it. Not necessarily adding them to the group, but running some ideas past them that we actually are seeing in guidance.
'Cause I know
coming
there's
out to see how they feel about that versus the practical approach, what's going on in the community, what the community risk is, and kind of those kind of things. So,
Okay, cool. I feel, perhaps this is just some sort of latent guilt about putting so much on Dr. Haug when I know he has got to be swamped. And I also know it's good to have involvement from the other healthcare providers, so it popped into my head.
I have had 2 conversations with Angie Littrell.
Oh, okay.
The CEO at Fitzgibbon, because I took to heart what people were saying, that Dr. Haug was under pressure, and I certainly don't want that. So I did initiate conversations with her, and she was very forthcoming, very open as to how she sees the situation impacting her organization, and then our organization also. But it's very difficult for them to keep the hospital open when kids are at home because schools are closed. And we understand that, and that's something that, so for our community, we have to look at. But she also then understands that with community spread the way it is, that there's almost no answer. We came to the conclusion that there's no right answer. At this point, neither one of us have the right answer, so, but it was really good to talk to her.
I wish somebody did have the right answer.
This is very.
I did too.
I wish somebody had
I
it.
forgot, I did ask Dr. Merritt to reach out to her, and she emailed us back, I think, today. Was it that we actually
She
got an answer
emailed me
from her?
back
Or
on
yesterday?
Saturday and then again today.
Okay.
Okay, cool. Any other questions, comments?
Good job, Brian.
Yeah, thank you. Thank you, Brian. Okay.
So, for purposes of just being as transparent as we can, what is the recommendation of that group for returning to school? And Dr. Mayor, maybe you can explain the numbers and how you're gonna get to that conclusion, just so that we're all clear and on the same page of that calculation.
Well, we do have some teachers here who wanted to talk, and they were in that conversation with the working group. But I will say that, and to answer a good question of yours before, was that I have not calculated the dashboard or those numbers since we entered into phase 4. It was way too, the numbers were way too big, they were coming way too quickly. And so, although I've kept them informally, and I know that today our number is 29.1, and Friday it was 30.4, I do know we moved into phase 4 when we went over the 12.5. I also know that there are some schools who are changing that number and changing that, that ceiling. So I feel that if there are ways that we're going to calculate, or if there are ways that we're going to think about change, there is a lot in the returning to learning plan that will have to be reviewed. Yeah, right now, the CDC has come out with some different guidelines, different recommendations, and then I heard today that there is a big backlash against those. So I'm not sure exactly. We've got the federal, the state, the local, the county. We've got experts everywhere telling us what the right thing to do is. So I do think that I am going to continue to watch the numbers. I got just a little bit, I felt a little bit of hope because it went from
It did, yeah.
40 to 35 down to 29 today.
did, yeah, it went
So
down.
maybe it's a trend. But I continue to calculate those so far as whether we will reach the point to come back to school. I think I'm going to depend on the committee to help. And we ought to look at that to be proactive so that we'll know, it needs to be predetermined when we reach that point, rather than just saying, oh, I feel like we can come back now. So I think that's something we need to talk about with the working group and with our medical professionals also.
And it seems that by the time we come back, it would be good also to have some clarification about essential workers, because it sounds like that was tabled. Is the working group going to come back?
Did you have more communication about essential workers after that meeting? I feel like after that meeting, did you have some conversation more? Okay, maybe I dreamt that. I was thinking that we had some, maybe I got an email about.
We had a follow-up question about some things that weren't necessarily in the initial email that she sent out from the first meeting about essential workers. That
Okay,
came
okay.
back, and then there was a little bit of conversation about that they were asked for like a little clarification about a couple of things, but
Oh.
there hasn't been anything as far
Okay.
as looking back out and saying, hey, we'd like to be essential or not. We kind of haven't pushed that because everybody's trying to teach and do everything else right
In
now.
terms of the
and-
classified
and
staff,
so-
though, that's the
Yeah.
essential worker
Correct.
question, not
Right.
the teachers. The
Correct.
teachers were non-essential, and you were gonna follow up with Kip and myself about that, because you were doing some more research.
Yes, and I did talk, well, I did not talk with Kip. I relayed a message to Kip that I feel, but he must be very, very busy. I haven't heard from him. But I will follow up with that again.
That'd be great. Could I be included in on that
Sure.
conversation? Thank you.
Has the R2L working group discussed at all the issues around teachers who have their own medical concerns, who have asked not to be teaching in the classroom?
No.
So that's, in other words, I'm assuming that that meant that that was an acceptable part of the plan.
No one's brought anything to my attention about teachers specifically and having issues within there.
Okay.
And that would be something that they should be bringing to their building personnel as well, and then going from there with that.
Was there anything in the plan about in what circumstances a teacher would be denied that?
What circumstances?
If a teacher, say, says, hey, I've got diabetes and I don't want to teach in the classroom, I'd rather teach distance, why would a teacher be denied that? Was there anything in that? about why a
There's
teacher would be
nothing in
denied?
there about denying. I believe it is, In one of the protocols or one of the scenarios, I believe I have an underlying condition. What does this mean for me? And if I remember correctly, the answer was to visit with your building level administrator, of course.
Okay.
And I can't really imagine any situation where we would not encourage that person.
Interesting. Okay, I just thought that it was probably tied up in some of the essential
I was gonna
worker
say,
conversation.
And from the conversations that I have had and that we've had on these calls, communication seems to be great within building level personnel. Ellen, would you agree with that?
I agree.
By the feedback from the group as well? So that didn't seem to be an issue at all within the group.
Cool. All righty, good to know. Anything else for Mr.
Aaron, you
Jiggs?
spoke about, someone spoke up and said they had a health issue
Yep.
and teaching online only. We discussed this in the beginning,
Yes,
and
we
now.
A decision together.
It'd be difficult
what I
at the high
understand.
school to have one.
That was the other conversation. Once you got to middle school and high school, the amount of classes and the differences in classes, it would be having somebody teach so many different things.
Yeah,
Well, and
not-
the certifications that they needed in order to be able to teach the,
I could teach a lot of
Specific
things
things.
online,
That
but I sure
actually
couldn't
seemed to
teach
help.
math.
Whenever
so.
when I was at the meeting, it seemed like the certifications, by the way that they kind of broke down, that it actually gave you a little bit more leeway because you could have somebody that was a third grade teacher that could teach a fifth grade class. Is that correct? I'm saying that in the certification up to sixth grade? Everybody's looking at me like I have 3 heads, so I must not be right today.
You were doing so well, Brian.
I was.
You were impressive.
Well, and some of it has to do
They,
with,
they agreed it goes up to 6, all right?
no,
My
but
thir-
at the high
my
school, that's
third
how it
head
is.
got a nod back there, so, but I just remember that, talking the meeting, there was some discussion about, sharing staff, different things,
Yeah.
when we were talking there about what would work. Now that you're midstream, it was also how hard would it be to change some of that and how much would that actually throw everything back off again? So.
okay. All right.
We had a stream issue for a few moments, or a few seconds, but it's fixed now.
Yeah, I
Everybody's
saw that,
getting-
yeah.
Oh, welcome
everybody's
back,
getting beat up
everyone.
by that.
Thank you.
All right. Any other questions? If not, then we are going to welcome, I think it's Mrs. Coslet, who's going to be talking about, well, I don't know. We've got MPS teachers and staff, COVID health issues, item B under old business.
I just have a report from the CTA just sent out a survey about Governor Parsons.
Is that the one you sent us, or is this a new one?
We
This
got,
is the one I actually sent this out, because everything's changed so much. since I came over. Basically, as of this morning, I had 202 responses, and it was just a simple yes or no. I thought we would keep it simple. And just over 64% of the respondents said that they do not feel comfortable switching to Governor Parsons' recommendation, and they would like to keep things as they are. So that is all I had for my piece.
It's interesting.
I had something to say.
That was 64% and you had 202 responses, correct?
202 responses.
so it sounds like things are aligning with, we're following CDC guidelines that's per the, yes, so here and
It's
there.
for all the same reasons the learning committee already identified lunch issues and special with all those things. That despite our best efforts as teachers, I think we're doing a really good job. There's still too many gaps that we just logistically can't cover.
Yeah, okay.
Are the teachers generally holding up pretty good? I know I'm about to
No,
go.
this year is unreal. I think as teachers, we're very adaptable, and so we're finding ways to make it work. And, we're kind of perennially optimists, and we believe we're gonna find a way, but I'm telling you, this year is unlike anything I have ever experienced as an educator, and I know that as I look around the building and look into the eyes of my fellow teachers, we are all very tired, and we are all hanging on. I don't even know how to describe what this year is like for someone who's not in it. It's, we're finding our way, but it's almost like you deal with yourself every day knowing that you're doing the best you can, but then as a teacher, you stay up at night, what can I be doing better? Am I doing this
You
better?
cry.
I worry about the COVID
You
slide,
cry.
all these things, but, and then there's the battle of I love this kid, I want this kid to learn, but I can't make him log on to the computer.
Right,
Yeah.
So,
yep. It's important for students to be participating. I want to say that clearly into the microphone. It is important for students to be participating
But they
to the
don't.
highest
I just-
extent. Parents,
I know.
please encourage regular, constant participation. Log on early, log on every day.
And as a parent, you know, I have a student in my home he's a fourth grader, and he's the son of two educators. I'm a fourth generation teacher. This is a boy who is saturated in education, and I still have to fight him every day to get him to log on. So
Some kids just cannot do it. I mean, I've been teaching online for years. I get more students fail in my online classes than my face-to-face. I can't reach out and grab them, and
yeah, that's
Oh,
one thing. So
my
and
own
like I said,
first-
I echo what you say, Dr. Meyer, that if I could give anybody one advice, as parents, we have to pick our battles and we pick our hills to die on. This is the hill to die on. Your kid has to come to school.
Yeah.
You know, and I feel your pain. I fight with my son every day, so I'm not coming from a place of, you know, but,
Yeah.
man, we've all got to do this together. So, the teachers are hanging in there, we're adapting, we're figuring it out, I think we're doing as good a job as could be expected, and I think some teachers are amazing. I look at what my fellow teachers are doing, and I'm blown away every day.
Yeah.
So,
And I know that it's not easy, right? I mean, I know that the kids also get huge stacks of paperwork to work on. I know that it's stressful for them too. But nobody's saying this year has to be perfect. We are saying that you have to participate. So, please, Ms. Gillespie.
I just want to let you know that when I have been in buildings, I do feel like that this, being in phase 4, we do have more participation than we have. I've had teachers saying they're having, and out of the class of 24, they're having 18 to 20 participate.
Fantastic.
And so I do feel that we have gotten more efficient and better, than, as we've learned over time. And so I've not had anybody saying, I don't have good participation. So whatever parents are doing different this time is truly better than what we had going on, obviously in the spring, and then even when we had some of our quarantine times that we, whatever that was. So I do feel like it has been a little bit better participation.
In the classroom,
In
Online.
No, in distance.
in distance
In
learning.
distance.
Oh, okay.
and I will echo that. I should have been a little bit more positive, Megan. Thank you for pointing that. But I know that last Friday when I sat down to make my emails, there were significantly less. It's just, getting them to participate, make sure they're learning. But it is still a struggle, and you still need to, show up every day.
Because
So,
they can be there, physically, but it doesn't always mean solid placement, but I do think we're having better participation.
So
in our Google Meet.
for those of you at home, Diane Gillespie was just saying that she was observing better participation, like over time, better participation in distance learning, which is great. So kudos to parents, kudos to students who are really sticking it out. We know it's not easy, but there's a reward in it. So you will find it if you keep working for it.
I just want to say thank you to Mindy and the CTA
Certainly.
for inviting me in. Keep on inviting me. Mindy and I have talked last weekend because I wasn't able to come to the meeting and spend a little time trying to catch up and stay on top of those things. And I think that we haven't really attended those meetings for the last couple of years I've been around. And I think that's a trend that we should continue whether I'm still here or not next year.
thank you, Mindy.
Yes, kudos. Are we ready to move on to the track and turf update? Yes.
Yes.
Did we do this one?
So,
Colbert
Oh,
Hill?
yes, that was this one.
Travis, were you supposed to speak during the, okay, I think I heard your name once, but, okay. So the track turf update and the magic word COVID. Oh, you can't hear it? So I guess, I've talked, this is a sad day for, the committee that I worked on, the coaches, the admins at the high school, the people in our community. If we want to run a campaign and be successful with the first round of COVID, we probably could have. With this second round of COVID, I don't feel like it's, myself, along with the people that I had working with me, we do not feel like we want to tackle a capital campaign of any sort, any kind of fundraising campaign to raise money for that outdoor space at this time. that does not mean that they don't want to spend, the money that we have aligned to fix what we've got to keep it, otherwise we're going to lose it. And so I talked to Dr. T very briefly. We've got an updated bid for grass. I've had a few phone calls that, we can go back through that whole bid process again. Dr. T doesn't feel like we necessarily have to, although the bid price, the grass price has gone up a little bit. At this point, if we go with grass, we'll have to go with grass. We'll have to fix the irrigation. Maybe get another price on the track and see if we're close. I think we are pretty close there. I think this group needs to say, that we understand the situation that we're in. We tried, and I think I think there's a better time and a better opportunity for us to do better things. If I was going to go out and raise money right now for something, I would try and get creative on how we can get CARES money to pay more for our teachers. Or I would go out and figure out how we can get CARES money to pay for, those helping in the buildings and not just limit to teachers maybe. I don't think my heart can stand out in front of a business right now that is taking a hit like our business is, and ask them to give us money for a facility like that when we have employees in here that are really working hard. We have kids that are, that might not have the equipment they need, or I know we have computers and things, but we still can use more. And so I just don't think it's ethical for us to look at a campaign right now in this community. So with that, and it stinks because I'm pretty passionate about that outdoor facility. I know that Mindy and I have had some conversations about it with BJ. Ian and I have talked about it. Ian's probably ready to cry. It's a sad day, and COVID has affected us on many levels. I feel bad because the seniors, we could have gotten this fixed and the seniors could have played at home on their home field this year. And I'm pretty passionate about that. So, it doesn't matter. At this point, we need to look at those bids. We need to figure out, I can work directly with Dr. T. We can bring that number back to the group in December, I suppose, once we iron that out, Dr. T.
Yeah, the bid, Ellen just gave me the numbers, and I haven't had a chance to talk to
Yeah, I just got them.
Brock, so, at the time, the original, when we bid it out, this low bidder, the grass piece was $74,123. If we added which he recommended, and I recommend, putting a new irrigation system underneath that was $26,500 at the time, for a total of about $100,000. What I'm seeing now, it's about $7,200 more than that. So the question for the board, so the $7,400 is not changing from Bruce and Music insurance. So $74,000
Yeah.
is being covered by them. And I'll have to get him on the phone in the morning, because at one time he told me he was gonna hold that, so apparently he stopped holding that price. So I'll see what I can do with him, but the question before the board was, do you or do you not want to add the irrigation system at the time we do the sod? Because that was a separate, I made him bid that separate for that purpose, and our system needs to be updated, I can tell you that. I
I
think
would say, wasn't half of it collapsed or a
we
portion of it?
had a problem with two different heads on it, and they're constantly and slowly and steadily failing on us.
Right.
I think the time of half measures is done. If we can at all find the money to do it, let's do it.
Okay. I
Yeah.
will talk to him, and I will get information back to Ellen.
There's no
and
sense
she
of
can
putting the
pass it.
sod down if we don't change the
Right.
irrigation.
No, we gotta do it
We need to be
right.
able to have
And
those
then,
things.
I will get his rock bottom price in the next day or two and get it to Ellen, she can get it to you.
Appreciate that.
I just think that's the most ethical thing for us to do at this point. So,
Well, thank you, Ellen,
Yep.
for your work on it, for
Yeah, you
coordinating
work
all.
we're not done. We're not done, but we gotta
Nope.
start here.
Yep, and, we'll have something, we'll have an improvement, if nothing else.
For
and
sure.
That'll be worthwhile.
But we're gonna have to do our due diligence as a district. We get new grass, we get new sod on that. We're gonna have to spend the money to keep it new. This, just like in this building, it costs money to have new things. It costs money to maintain things. And if we're putting $74,000 of new grass out there, then we need to maintain it like it's a $74,000 grass. I mean, we've got to do that.
Yep,
So,
here, here.
Moving along.
All right, moving on to new business. I am happy to tell you that the Board of Education filing dates for the terms of one Aaron Meyer and Brian Jakes are up for election. The filing dates are December 15th, 2020 to January 19th, 2021. Let's see, I'll keep reading this. April board meeting will be Tuesday, April 20th, 2021. So for the, you too can sit in this seat and bang that gavel. All you have to do is sign up. Okay, so but in all seriousness, we do encourage all willing and eligible candidates. Let's move on to item B. December board meeting date, hear ye, Tuesday, December 15th at 6:00 PM.
Here or,
Yes, probably here.
Just to throw another date out, if I didn't say it before, I'm looking at the 9th of December at 3:30 for the next Return to Learning Committee meeting. I have not sent that out, but I plan to get it the weekend before, or the week before we actually have the board meeting.
Could you repeat that?
9th December.
The 9th of December at 3:30. That date will probably not hold, but we will see what happens when we send it out. I am optimistic.
yeah, okay. December, sorry.
No, that's okay, I'm gonna let everyone get
It's
caught
just
up.
tentative. We're gonna send out the group email, and if that doesn't work, then we will reach you.
I'm just putting the board meeting in. I just want to make sure I'm on it.
And I'm gonna hit all those dates from the top. So Board of Education filing dates, December 15th to January 19th. You simply go to central office, yes, even though we're
Pick up
still,
a packet.
okay. Yeah, go to central office, pick up a packet. That's how you can file. December board meeting date, Tuesday, December 15, 6:00 PM. Be there or be square, or tune in or be square. Practical, are we ready to move on? Are we ready? Okay. Item C, then under new business, practical nursing program tuition increase for 2021, 2022. And we received this in the packet, I suppose, that, yeah. Is there anything you'd like to say or add, or?
They're asking
Ms. Duncan?
or we are asking to increase the tuition to $500 additional dollars. We're trying to get to be 100% self-sufficient. That's helped us get there with the new class coming in, especially if we do eventually increase our facility to be able to add more students. That then gives us a surplus of money to continue to be self-sufficient. That would allow us also to then spend some money and keep some money back for simulations. Part of our COVID money that we have received through FIPSI and our HERF grants means that we are getting mannequins that have simulators in them, which is awesome. However, we have to maintain them now. This grant is only here for this year, so we have to be able to maintain them. So that is updates in software. Those are anything that happens to it overuse. So this would allow us to then build in some money also to continually repair that.
This also brings us better in line with comparable programs within the area.
Yes,
So,
while still keeping us under, like, we stayed right there in the middle of local or
Right.
regional schools the same size as we
just
are.
want everybody to understand, we haven't raised the rate in quite a while, and that we're actually not going above other rates within our area. We're just going up to a level that would help us be more sustainable within district and more comparable price-wise.
Correct.
I do have a question for you, Kelly. The tuition, the books, our books seem to cost more than other areas. Why is that?
And we looked at that, and it's all in how they report it. And so Heather and Laura got with all of those other PM programs. And so some of them, we buy all of the books for our students up front. And so that is all of their costs, and to make sure that they have all of the books for every class. Some places just say, here are 3 books we make sure you have to have, and then it's up to you if you want to buy them on your own. So we take care of that because we believe that it's important for them to have all of the books and the exact editions that you're going to be teaching from.
Thank you.
Any other questions?
I make
about-
a motion that we accept the rate as it was. I don't have it wrote down on my paper, I'm sorry.
We
Do I
need-
need to
yeah,
say the
we
number?
To approve the practical nursing program tuition increase for 2021, 2022.
Okay, then I will say it that way, then without numbers. I so move that we
Approve the
increase for tuition for 2021, 2022, as outlined in the packet.
I second.
All those in favor?
Aye.
Any opposed? Okay. Now, here's where I become the skunk. So, the next item on the agenda is the Director of Curriculum and Instruction position, and I want to frame this up before I turn it over to Dr. Mayer to talk a little bit more about the position. When the board received Diane Gillespie's letter telling us that she wouldn't seek a renewal of her contract, that of course sparked a discussion about, well, what happens next, right, with that position. The board made clear to the superintendent that we wanted to seek input from various stakeholders, that is, building level administrators and teachers, about how that position, the curriculum and instruction directorship, as it is currently configured, is meeting their needs. Am I right so far?
You are absolutely right.
Okay. We asked Dr. Mayer for that input. Dr. Mayer told us that the board should let the administrators make their own choices about how to staff and structure that position, but said that she would nevertheless see what the administrative team thought about seeking that input. Would they be able and willing to seek teacher input about that? She then sent me an email with an updated position description and some of the historical, what Ms. Gillespie's position description had been, because we had asked for some of that background detail as well, Harry had. I asked what input had she received from teachers in addition to the administrators. The next day, Dr. Mayer sent an email saying that the administrative team unanimously had agreed that the teacher input should not be important here. One administrator's anonymous comment that was forwarded to me was that teachers might not be able to contribute much to a discussion about this position because they don't understand it. I say all this to say that I would like the board to be on record that the board did want that teacher input. We still want it. We think it's important. And I didn't know that we needed to ask so many times for it. And I'm confused. I'm just confused about why the administrative team thinks the teachers don't know enough about it to have some input in it that would at least help us to understand whether we want to continue, whether this model is one that is working for them or not. After all, different districts do this position different ways. Sedalia has 2 directors, one for elementary, one for secondary. Columbia has curriculum coordinators for every academic department they have. There's like more than a dozen of them. Wentzville has content specialists who are kind of sharing the load among them. Springfield has subject matter experts as curriculum leaders. Right? So it's not as if there's only one way to slice this pie. And we were interested in some other ways, since this is an opportunity for us to start being creative about it. So our concern was with providing the district with innovative or seeing some innovative options. And I guess I'd like to kind of open it up and see if there's some way I could maybe get some understanding about why teacher input isn't worthwhile in this matter, because I really am confused.
I think your choice of words are unfortunate there. Never has anyone stated that teacher input is not worthwhile.
Yeah, it's got it in writing.
And now, okay, I'm sorry that I'm interpreting.
We've got it in writing.
I understand that. I understand that. I just think it's unfortunate the way it was presented.
So please tell me how it was wrong, because I would love to know why we can't have teacher input into this. or why the teachers don't know enough about it to be able to say something useful about it.
We're gonna sit here all night.
Okay.
Yeah.
Do you want me to talk? I mean, I can talk the entire time if you want me to.
Okay, well,
I was gonna say, if we wanna have teacher input, then I think we just ask for a survey, you come up with a list of questions that you want, and we ask Mindy to send it back out to the district, if we wanna do it that way.
We
Well-
sent that as a suggestion.
yep, so
I'm
it
not
sounds like
saying we
that's.
send a suggestion, I'm just saying we just say
Let's
it's
just
gonna
do it.
happen.
Okay.
At this point, if that's something that we'd like to do.
Is that
Okay?
something that we would like to do?
Well, I'll add to what you said. I know, I mean, it sounded unfortunate, but unfortunately, that's the way it was portrayed to us on this email. I mean, twice on here, it basically said, it would be difficult to give an opinion on a position you don't fully understand.
Hey, put your mic down. Somebody might miss your important words.
So, I mean, it just seems like the last two times that we've requested something, it's come with pushback and assumed that we were gonna use it as a hatchet to cut everybody's throat, and that's just not the case.
Nope.
I mean, I'm new at this.
It's an opportunity to improve our district.
I'm new at this, and I don't know if it'd be any different if I was 20 years on the board. I mean, if there's a decision to be made and we have to make it, we need to know why, what we're looking at, and what the alternatives would be. We just bought programs for distance learners. I mean, how are we gonna know if they work if we don't have anything to go by? So,
You know, once again, I think it's very unfortunate, and I know exactly what it says on there. I'm not sure we'd ask a kindergarten teacher to hire a physics teacher.
That's not,
But
that's not the
But
point.
the,
That's not
what I'm trying to say is that the administrators have the administrative team for a reason.
Sure.
And we totally understand that administrators impact teachers' lives, and we want them to impact them positively. But being in the teachers' ranks, you're not in the administrative ranks. And evaluating teachers is a very difficult thing. And especially when you have to have difficult, courageous conversations, it's a very difficult thing. The director of curriculum and instruction is in charge of evaluation.
Of the teachers or the curriculum?
She's in charge of training principals to evaluate teachers.
That's a very different thing than being directly involved with that kind of evaluation. And by the way, I do need to issue a correction to myself. It was not unanimous. I do know that there is one admin person here who has written, I value teacher input and we should allow it as well. Their input becomes a consideration when making the decisions as an administrative team. I do stand corrected. So,
Clap, clap, clap.
apparently one person thinks so.
well, and I didn't mean that we should put the teachers together and pull names out of a hat to hire.
Yeah.
I guess what I meant was, the teachers spent a year writing the curriculum.
More than that.
Well,
More than that.
so
They've
why
been doing
wouldn't
it
we,
Since I've been on the board.
why wouldn't we at least get their input on,
Yeah, I
On
agree.
what's
I mean, that's-
working and what's not.
On what's
That's
working
my
and what's
point.
not.
you know, if they're gonna write the curriculum, if they're gonna drive the bus, if they're gonna be the engine, why not ask them what kind of fuel they want?
Well, and I mean, with all
To
due
where we're going.
respect, this communication, I mean, it was 2 or 3 months ago that Mindy and someone else stood up here and her entire group and said, you guys are not listening to us.
And
Now, we
all we want
specifically
is to listen
asked,
to them.
please, let us
Please let us
hear.
listen to them, and
And
we
we
are
got
being told,
nothing.
no, 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 repeatedly, no. I think the time has come that we should issue our own survey. We would work with CTA if CTA were willing to work with us. But if we have to move on our own to make this happen, or if we have to take a vote compelling a body or department within our school district to make it happen, we by all means can. I don't think right now is the time to do that. I would rather have our specific language, and I think that I would prefer to have a better sense of what the survey would look like before we do that. But I did want to frame this conversation up to say the board does not have all of the information that we desire. And we are therefore not prepared to be making any decisions, although we will be very interested, I'm sure, to hear what Dr. Mayer has to say about the Director of Curriculum and Instruction position as she has prepared remarks for it tonight. But am I by myself in saying that I think that we want to have this input from the teachers and that we will seek it one way or the other?
You know, I don't think you have to.
Before we go all the way in,
we're in.
I'm a little torn on this, but only, I mean, everybody has an opinion, and it's all right. I can be the outlier because I'm not always the outlier. We don't ask people don't come and ask you to interview their bosses. That usually happens on a interview team, a higher level. So you're asking people to help choose someone, possibly. Are you looking for criteria?
No.
Are you looking for criteria? or
No.
This is about the
No.
model. This is about,
This is about the model.
The position
Okay.
itself.
So- That's what I was
And she
making
just
sure.
gave examples of.
Like
other
I
we-
understand what
schools,
she
yeah.
gave examples of, because I've sent her some of those examples.
Brian, when
So,
I,
then,
We did
it's
not-
about a
Just the
person.
Sedalia one, but.
we did
I
not
understand.
have a
that from
full-time
Kristen.
curriculum coordinator. The curriculum coordinator full-time position occurred at my very first board meeting. You were there,
Yes.
and it just happened.
Yeah.
And I'm going, whoa, that's how things happen around here.
Didn't
Not
you have a
anymore.
curriculum director?
And we had an assist, part-time.
which, by the way, this
She
brings me
went
to.
full-time at my very first board meeting.
There
I'm
was
fine
a full-time
talking
one
about
before.
criteria and models.
Yes.
I didn't mean looking at qualifications and individuals.
No.
Okay, hold on,
I just wanna make sure
I want to
we're
know
looking at
something.
two different
Dr. Mayor, elaborate. So Diane was part-time, and while Diane was on a contract, we had another, or while Diane was doing contractual work, we had another full-time curriculum person?
No, before Diane was here, there was
Before
a-
Diane was here, she was contracted, though, to be part-time, right?
I was
Yep.
originally a contracted employee, working 2 days, the workload was more than that, and I was able to move to 3 days.
Right.
And then I went to 4 days, and then when I came the year that Mr. Carroll is speaking of, the only option for me to stay at Marshall was to come
Full-time.
full-time, because they felt it was a need. At that time in my personal life, I was able to make that decision.
Sure. I just wanted to understand, because I was
No,
like, we had a
no,
full-time or a
wait.
part-time, I'm
Well, wait.
confused.
Before Diane got here, we had Aaron. Before, Julie. Before that was Aaron. Bef-
Aaron was a special ed director.
Okay, who was before Julie?
There wasn't one.
Julie was the first one?
That I have the history.
Is that right, Randy? You guys who have been here a while, Janine? But,
Before that, there was a full one.
yeah, there's been a
Okay,
full one.
so we've had a full-time, then we went to a part-time contract, and then we went to a full-time. I'm just trying to make sense of, I was hearing like 1.5, so.
No, I came in interim with Dr. Mayer, and then as she went full-time, I just kept
Okay.
going until I got to full-time.
Okay. All right, I just wanted to make sure I wasn't thinking like 1.5, hearing like 1.5 maybe with
No.
a full-time and then Diane. Okay, all right.
So let me try to put back together the administrative team here that has been, I'm sorry. So let me try, I'm just going to try to communicate the way that I should have communicated before. So they don't take anything that I should have on me. What we were talking about, when we talked about the director of curriculum, was, should we have 2 people in that spot? It was suggested that maybe we look at an elementary, and maybe we look at a secondary, because the elementary can't understand the secondary, and vice versa. Should we have instructional coaches with that spot? Should we have, there were many things that we talked about that were just kind of housekeeping things. Those were the things that we said that the teachers, why would they even care? We don't,
My heavens, why would the teachers care? Because these are the people who are helping.
I mean, if we have a part-time for elementary and a part-time for secondary,
Yes.
okay, I understand, I guess I understand that, and I'm sorry. I'm sorry, I'm not
I
doing a good job here. However, the things that we were talking about as a team were the details, help me say, it wasn't the philosophy. It wasn't how teachers would be treated. It wasn't how important anyone was or anyone wasn't over someone else. That was not it. It was basically just how to set up the position.
Okay. All right, I'm gonna go.
I
I'm
got
gonna
you,
go.
I got you.
We discussed this, and we discussed it in length, and then all of a sudden, we talked about things that we could do for curriculum, and not opposed to it. There were several directions we could go, then all of a sudden, this pops up as an agenda item. I would like to see some studies, as Aaron's already done some stuff. What does our school district need for curriculum?
Well,
Or a
I
curriculum
probably
director.
asked Aaron 3 or 4 times about being on this agenda.
Yeah.
We spoke back and forth about this.
We did? I know you sent me the position description a couple of times, but
Yeah,
I think there was just one.
I requested the description.
There was just one email saying, hey, we need to put this on the agenda, and I said forthwith, and just let Linda know, and hey, I think that was the one where I said, hey, also, tell me about what teacher input you've gotten so far.
And then I asked for the old description and the new description.
Yeah.
And I will
Yeah.
tell you, when I saw the new description, it looked more like other things other than curriculum. And it was one of the
Well,
things.
this is the first time I've
Yeah.
heard this.
And then if you,
all this.
you know, I didn't know how this
Heard all
meeting
of
was
what?
going to go, but if we're going to hire a full-time curriculum coordinator, I want a full-time curriculum coordinator who will work and write curriculum.
Which actually, so when's the last time we had a curriculum steering committee? Do we have a curriculum steering committee?
We have a curriculum review team that reviews it and looks at it as experts in the content area.
Does that review committee fulfill policy IF?
I'm not sure what that, I don't memorize, so we have to.
Policy IF states that we shall have a curriculum steering committee. Should have a, quote, wide spectrum of administrators, teachers, board members, students, parents, and community members. And this committee shall review the curriculum. Curriculum review should happen the year prior to the fiscal year in which funds for purchasing curriculum and instructional materials are allocated. Are we not in compliance with policy IF? So this is.
Our current team has teachers, administrators, and that is all currently serves on our team, and they have not met since last spring.
Yeah, so we haven't been in compliance with our policies even for quite some time, right? So we need to be looking at different models. We need to be having a larger conversation about what's going on. And I tell you what, the reason I knew that we weren't in compliance with policy IF was because a teacher told me. So I value the teacher input, and I would like to have some. But it sounds like we're probably going to have to take a step back from just tonight to take a moment and kind of gather our thoughts about what kind of teacher input we would like to have. I'm going to cede the floor. If anybody else has any other comments, questions, concerns, issues, they can go ahead and issue them. And I know that Dr. Mayer had some other things that she wanted to say about the position. So
I'm more than willing to
I
hear.
yield,
I'm more than willing to hear them.
certainly.
Thank you. We have had a really great experience with Diane, being the director of curriculum instruction here. We've been very lucky to have one of the top 3 people, probably. When you start looking at her job, and when you start looking at how to fill her job, I think you have to stop for a moment and understand that we're not going to have Diane. We're going to have someone with fresh new ideas, someone's with fresh new ideas. I think when we talked before about different models to bring to the board, my reply was then, and it would be now, that that would be an administrative decision and an administrative recommendation. Now, does the board have the absolute right to tell me how that's going to look? Absolutely. In my own thought processes, I feel that's an administrative task. However, so I then, at the point where I said that should be an administrative recommendation. I believe that I said to the administrative team, there is a opportunity, or we are supposed to look at, or we can look at, or something, at different models for the central office. If we are looking at a different way of serving through the Director of Curriculum Instruction, maybe we should look at the central office too. Maybe we should look at different ways to organize the central office. When we talked to the administrative team about that, about the model, we came to the understanding that we really feel it's important to have one central person in that position. We thought that if there was an elementary and a secondary, that we would not be able to, let me back up, that would be ideal. We can't afford that, I don't think. And every district that I know has some real complaints about too many administrators, especially in the central office. So we knew we couldn't and shouldn't increase the number of administrators. We were happy with our one centralized curriculum and instruction person who could really see the K-12 spectrum, the big picture and how it moves through levels. We feel that's important. We feel it's important to look at how that person's time is scheduled and how that person, how their obligations and their duties are organized. These are the things that, following in just a moment, are the things that I thought that the teachers would not necessarily need to, or, well, I said want to a minute ago, but that's not right. So I don't know if the teachers would necessarily be concerned about whether we have one or two people. I guess they would be, from what I gather now. I don't know if the teachers would necessarily be concerned about whether they had an administrative degree or a curriculum instruction degree. I don't know if the teachers would want necessarily to have the curriculum and instruction person, director, be in charge of teacher evaluation, for example.
It's one way to find out.
There is. Those are just some things, the details are the things that I didn't think that the teachers and the administrators would necessarily have to get together on. We were pretty solid in that a lot of administration has to do with just organization and just how the chain of command goes. It is absolutely not true that we did not care about what the teacher said. It is absolutely not true that we don't have the teachers' welfare.
Well, I certainly wouldn't say that. I would not say that you do not have the teachers' welfare in mind.
Well,
Welfare is not the question.
I'm sorry that it doesn't read that way, but it is not true that we don't.
Well, okay, I didn't mean to interrupt you, but I was really upset a few meetings ago when teachers said we weren't listening to them. And then this thing happened, and it was enough to make me go off the end. I will always listen to what the teachers have to say, and I wanted to know what they had to say. And I read these things, and I went, what in the world is going on here? We have a meeting that was almost tense. We're not listening to the teachers. I'm listening to the teachers.
Yep.
Teachers drive the train. You're the engineer, and the teachers are driving the train. And I'm going to do everything I can for the teachers. And if, well,
I just don't think you'll find teachers that will say their administrator does not care and does not have their best
No,
welfare.
you're
I don't- I
changing
don't
the
think-
I don't
subject.
feel like that's what we're asking
You're
for,
not, that's
though.
not what we're talking
I
about.
don't think that's what we're asking.
Okay,
That's certainly not what
are
I've
you-
ever.
What are you asking then?
Well,
Oh, my gosh.
we're
I mean,
asking
is it about the central office? Is that what?
No, we're asking about the model. We're asking about opportunity. I'm not directly asking about any person in direct, but what works for Renee and what works for Janine and what works for Amy teachers, and I'm just pointing you out because you three that, maybe they have some expertise. Maybe they studied about a different model. Maybe they have some ideas. Maybe they have just some thoughts that they would share if they were asked. When we were told we were not listening, and then this opportunity came up, there's a lot of discussion, you guys, that we get that, and we're told, run the chain of command, and it's fine. Run the chain of command, but if we have an opportunity here to evaluate a process, and we have an opportunity to evaluate and make sure that it's the best process that we can possibly offer, then why not? Why not ask? Why not evaluate it? Why not, honestly, and this is my opinion because I've only sat here a few months, but I don't know why we haven't said before, Diane, for 2 years, have you been able to do your job the best of your ability? Or have you been struggling because you've been doing everything else and then trying to do this over here? I don't know the answer, I don't need the answer, but maybe we should have been hearing that, and we haven't. And so, we haven't. And that's been told to teachers, that's been told to administrators. And so, we're asking that now as an opportunity to say, what we're doing the very best we can do? And that's what I want to know. Is it the very best for you as a teacher? Is this the greatest thing that we could give you? Is this model the greatest thing we can give you? Yes or no? It's really simple. And if it's not, then what?
Then what can we replace?
How can we do it? How can we do it? How can we be great for you? We can't support you unless we know.
Yeah.
That's it. It's not about somebody in particular. This is about procedure and process, I think. That's my understanding. And an opportunity for us to evaluate how money's being spent, where it's being spent, and the service that we're getting for it. Are we doing it great? Then great.
I said what worked and what is broken. We need to just decipher what those things are.
Remember that?
And we all have to work as a team, unfortunately. It has to be everybody collaborating together, the administration, the teachers, the board,
Yeah,
superintendent.
yeah. Yeah.
This went off the rails in a hurry.
Mindy, when you do a CTA, and I'm only asking because I don't know, when you do a CTA survey, thank you, does that go to all teachers or just your CTA members?
We send it out to everybody.
Okay,
It goes to the entire district.
yeah.
I got
So-
the last, thing, I could have,
Okay.
I could have been one of her 202 responses.
You got
Okay.
one, and you got
I just-
one
I
and
just
I
asked-
didn't, okay.
I just want to make sure we touch,
Goes to your school, goes to school email.
It's sent to your Marshall Allen.
Yeah, school email.
Oh, I know. You said-
Yeah, that's why.
I just want to make sure that they go out everywhere. Okay.
So to center this back, it sounds like we want to have some questions that we want to ask out to the teachers, we just need to devise them, correct?
I think we want to,
Okay.
I mean, does it have to be, can we not just, I want to hear from I want to hear from all of them. I want to hear from Amy and Janine, and I want to hear from all of them. I don't want to just hear
I
from
think-
teachers
I
alone.
think the administrative team is going to give input and has given input, correct, to this point, it sounds like?
Yeah, they've given
Yeah,
a
as
lot of
group.
input.
So if you're looking for the other side, then we just need to ask for the
Okay.
other side, and then we put the two together and.
I haven't heard this
come out
side completely yet.
So that we can start advertising for it and look for someone before we're looking for someone in April that already has a job.
Mindy, would you like for CTA to get together on that, or would you like for us to approach you with questions?
I think probably we will talk, but I would like to know what it is you guys are looking for.
That's the
I want
issue.
to make sure that it doesn't become a critique of the current position. I really want it to be focused on innovation and
Yep.
what are your thoughts? And
Well-
like,
Yep.
I don't.
Yep.
I think, even Dr. Mayer had a few questions after talking with us that she had brought some up, and even I'm sure Diane has some that she could bring to the table in that position, that maybe a collaboration of everyone just submitting those. It's not just us, but other people may have something that could add to that to help us.
I would like to point out that the title is curriculum and instruction, and many of the bullets under my job title follow with instruction. So evaluating teachers and helping principals understand that role is looking at the instruction in the classroom. Evaluating, I'm not in there doing it for them. They ultimately make the decisions of what instruction looks like in the classroom. So curriculum is one portion of it, but instruction
Yeah.
They're teaching, they're like, oh, they hear instruction, they're like, oh, but they hear learning, and it's a different perception of that role. So I would really like to encourage that as you all as a board move forward. And the models that you mentioned, Dr. Meyer, are in much larger districts.
Would you,
And then, to employ two full-time, if that would be a model you would consider, or content specialists, they would really have to be a part-time considering financial, unless it's something you all were to decide to put the money forth in that.
I mean, if we find something that's gonna work for us.
Believe me, there are many times I wish I had a counterpart.
So rather than limiting the conversation by making assumptions about what we won't or will like, or what will or won't work here, or what they think, or what he thinks, or she thinks, or whatever, let's just find out.
And I 100% agree, and I understand, it's just,
do you
moving
have a,
forward, I hope that
do you,
the district can continue to, and COVID has stopped so many things. I had a list of goals, and I've got 3 or 4 at the very bottom we never got to, because that we're gonna have this year because of COVID, I really hope that as the teachers think about it, they look at it as teaching and learning support versus the true words in the title. And that, I hope you get creative, because it's a long list of things I do.
one of the things I'm looking at is, because we are so spread out, so many buildings and so many other kinds of things, I don't even know how you can work that kind of a job, working from high school through the different grades. And when you talked about that teaching and learning thing, I was leaning, just my first thoughts when we talked about this is maybe spread it out over so that it's going all the way. There has to be one central place, and I agree with that 100%. We probably have to have somebody coordinating all of the curriculum. But the steps through there, we got a building here and a building here and a building here, and now we've just added another building. And I don't know how you can do that job, all the way through. But, that's why I want to see different models of ways we can approach it uniquely to the Marshall Public School System.
And why bother to chase down, say, like, if I happen to like the Springfield model, which I don't necessarily, but I just happen to, if I happen to like the Springfield model, why bother chasing it down? Why bother being its biggest cheerleader here if it turns out that that wouldn't work for the teachers? Because that's not at all what they were enriched by out of your service, right? Like what they got out of your directorship, the things that were working for them, that's nowhere near the sorts of problems that get solved by the model at, say, Springfield, for example. We won't know that until and unless we find out what was working for the teachers, what was serving them best. And really, at the end of it, it gets down to what's working for the students and the families of the community, right? Because the teachers that's how they are if this were a business, the teachers would be our product. They should be the thing that we are the most proud of. They're the thing, but think of it this way. This is the way it was explained to me by a dean at a job interview I went to. I want my students to have the best experience possible. That means I need my faculty to be the best equipped. That means I need my faculty to be happy. That means I need my faculty to be working as well as possible. I want to know right now how the faculty are best served through that position. And they will have input. They will have feedback. And the students will be better served, the families will be better served for it. So,
I hope, administrators, that tomorrow you'll get with your teachers. Tell them once again, as we've told them so many times, how important they are to us.
indeed.
What they mean to us. And interpret it your way so that nothing gets lost in translation. And so that they really know, truly, once again, how administrators feel about them. From the building to the central office. I really appreciate it.
Do you have a motion to move into a closed session?
So moved.
I second.
Pursuing legal actions, hiring, terminating personnel records. Roll call, let's start with Brian.
Aye.
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 Aye. We'll need to fill the feed. Mrs. Cosworth, have a good night.
Diane, could I ask you one question?
Ma'am.
Yeah.
Fine, fine. We've got plenty of time, so don't stress out about it.